most frequent use of drugs are the stimulant drugs and painkillers. And that's because they're so readily available. And those are the two drugs that, in my experience, I think have my greatest concern. In part because of the ease with which physicians, dentists will prescribe painkillers. And most people, most young people, students from 12 on up, are going to find their drugs in the family's medicine cabinet, or actually be given drugs by their family members or friends. Prescription drug use that is use that's non-prescribed is going to mess up your brain. And from the time you're growing up until the time you're 21 or so, your brain is developing. And as your brain develops, all kinds of things occur, especially if you abuse drugs. And that part of the brain that is essential in decision making is not fully developed until your early 20s, 20, 21, 22. And what we know about substance use and abuse is that those young people who do not use until the age of 20 or 21 are much less likely to become abusive. In fact, the risk of abuse is cut in half. So it's imperative that young people and parents understand that if they can keep their young person from substance use, experimentation until they're 20, 21, they cut the risk of abuse in half. Adequate treatment and response has a significant benefit to our community, and we need to understand that. So making those kinds of services available to people really benefits all of us. And to not consider drug-related crimes as much a violation, as a criminal violation, as it is a need for treatment. And we need to have programs to defer people who commit crimes to support their substance abuse. And we need to defer them into programs that are treatment programs. Those are much more economically beneficial, and they have a much greater long-term consequence. And there's not nearly as much recidivism. But relapse is part of having a chronic illness. And any chronic illness has some expectation of relapse. Whether it's diabetes, whether it's obesity, we all struggle with certain kinds of illnesses that we need to change our behaviors, in which over the course of time we may find ourselves relapsing. Because as a person, we're not very consistent. People are not consistent in their behavior.